Welcome to your deep dive on cardiac drugs. We're going to be opening up those notes you've got from Lesson 10 on cardiac drugs. Get ready to learn the secrets of a healthy heartbeat.
It's true. Knowing about this stuff can really make a difference. We'll be looking at how your heart finds that sweet spot, for optimal performance, and how meds can lend a hand when it needs it.
Okay, so before we get into the nitty-gritty of specific drugs, my notes start off with this equation. Circulatory volume equals venous return times contractile force times rate. It seems like this is the key to really getting how our heart does its thing.
You hit the nail on the head. That equation, it's really the bedrock of cardiac medicine. It tells us that the amount of blood making its rounds through your body every minute, which is, of course, vital for delivering oxygen and nutrients everywhere, hinges on this delicate dance between how much blood comes back to the heart, how strong the heart pumps, and how fast it's going.
So like a three-part harmony, one part's off, the whole system's off.
Exactly. Picture a relay race. Venous return, that's your first runner, bringing the blood back. Contractile force, that's runner number 2, showing us how much power the heart's putting into each pump. And then we got heart rate, our third runner, setting the pace for how often this whole cycle happens. Any of those runners trip up, the whole race is done.
Makes total sense. Now, my notes also mention tissue perfusion. What is that exactly, and how does it play into this relay race we're talking about?
Tissue perfusion, the grand finale of our relay. This is what it's all about, making sure that oxygen-rich blood gets to all the tissues and organs. Every single cell, from your brain all the way down to your toes, needs that constant supply of oxygen and nutrients, and that's tissue perfusion's job.
So if any of our runners in the relay race are lagging behind, weak contractions, slow heart rate, or not enough blood getting back to the heart, it directly messes with how well our tissues are fed, so to speak.
Spot on. And that's where those cardiac meds step in. They're our coaching team, each one trained for a specific part of the race. We have some meds that'll boost that contractile force, giving that second runner a boost. Others might focus on regulating heart rate, making sure our third runner keeps a good pace.
Fascinating. It's like having a whole toolkit for the heart, each tool fine-tuning a different part of its performance. Now, my notes mention inotropic and chronotropic agents. What are they and what makes them the heavy hitters?
You got it. They're the MVPs. Let's break down inotropic agents first. These guys directly affect how forcefully your heart beats. Imagine your heart's a pump, and these drugs can make that pump work harder with each push.
Okay, so they're basically strength trainers for your heart, giving it that extra oomph.
Exactly. A classic example is Digoxin, been around forever and still used today. Think of Digoxin like it's subtly messing with the pump, causing a little traffic jam of sodium and calcium inside the heart cell. This calcium buildup is like a jolt of energy for the heart muscle, making it contract harder.
Okay, that actually makes it much easier to picture. So Digoxin is basically making those heart cells squeeze harder. What about those chronotropic agents then? Are those the ones working on the heart's rhythm?
You got it. Chronotropic agents are all about heart rate. They can speed it up like hitting the gas or slow it down like tapping the brakes.
So finding that perfect tempo for the heart, whatever the situation calls for. Do we have an example of a chronotropic agent? I'd love to hear how these work.
Let's take dobutamine. It's a beta-adrenergic stimulant, meaning it acts a lot like adrenaline does on the heart, but in a much more controlled way.
So it's like giving the heart a little pep talk, huh? Encouraging it to beat a bit faster.
Exactly. Here's the interesting part. Dobutamine is what we call selective. It mainly focuses on the heart, unlike adrenaline, which can have broader effects on the body.
Sounds like a more targeted approach, which seems crucial when you're dealing with something as important as the heart.
Exactly. It's a delicate balance, effectiveness, and safety. Now, speaking of balance, there are two other big players to consider when it comes to how the heart pumps. Preload and afterload. Think of preload as the blood filling up the heart before each beat, and afterload is the resistance the heart has to push against to get that blood out into the circulation.
So if preload is like blowing up a balloon, afterload is that knot you tie at the end, right? Making it harder to blow more air in.
Perfect analogy. Understanding both is crucial for choosing the right meds. Let's say someone has high blood pressure, meaning their heart's working overtime to push against that pressure. Certain meds can help by reducing afterload, essentially loosening that knot, giving the heart a little break.
Wow, it's amazing how all these factors work together.
It's really quite something. And the more we can understand about how it all works, the better we become at making good choices about which cardiac medications are best for each situation.
I think we need to spend a bit more time on these ideas of preload and afterload. They seem really important to understanding how all these different medications actually help the heart.
Absolutely. They're essential, and it sometimes helps to have a picture in your mind. Imagine a rubber band. Preload is kind of like stretching that rubber band. The more you stretch, the more potential energy you have to make it snap back, right?
Yeah.
In the heart, higher preload means the heart muscle is stretched more, and it'll contract harder, just like that rubber band.
Okay, so more stretch, more power, I get that. But what about afterload? Is that like if you were trying to shoot that rubber band across the room, but someone was holding on to the other end?
You got it. Afterload is all about resistance. Like, imagine the heart is this powerful pump pushing blood through a bunch of pipes, and those pipes can get narrower or wider depending on things like blood pressure, right? High blood pressure is like having narrower pipes. More resistance makes the heart work harder.
So some medications can actually widen those pipes, reduce the afterload, and give the heart a much-needed break.
Exactly. And that's where knowing the specifics of each medication is key. Some medications mostly focus on reducing preload, others are all about afterload, and some might tackle both. Really just depends on the patient and their own heart situation.
This is where it really starts to sound like walking a tightrope, carefully adjusting everything to help the heart do its best. Now, my notes also mention a group of drugs called cardiac glycosides, like Digoxin, which I think we touched on briefly before.
Yes, cardiac glycosides. They've been around forever and still have a place in cardiology. Digoxin in particular is an interesting one. It's like the wise old sage of heart medications, you know.
Okay, you've got me curious. Tell me more about this wise old sage and what it does.
Remember when we talked about Digoxin messing with the sodium-potassium pump just a bit, causing that buildup of calcium inside heart cells? Well, the calcium is really important. It's like a shot of energy for those heart muscle cells, making them contract with a lot more force.
So it's like Digoxin gives those tired heart muscles a little motivational boost, encouraging them to pump stronger.
Exactly. But like any wise old sage, Digoxin needs to be treated with respect. It has what we call a narrow therapeutic index. That means the dose that works well is pretty close to the dose that can cause problems.
So it's a bit of a balancing act. Too little and it might not work. Too much and it could be harmful.
Right on. That's why we got to be super careful with Digoxin and monitor it closely. We want it working its magic, but staying safely within bounds.
Makes perfect sense. Now, let's switch gears a bit to another group of meds that seems super important in cardiac care. Beta blockers. I feel like I hear that term all the time, but I'm not entirely sure what they're all about.
Beta blockers. They're like the calming mentors of the heart world. They work by blocking how adrenaline affects the heart. Now, adrenaline is great when you need to, say, run from something scary, but too much adrenaline in our everyday life, well, that can really strain the heart.
So beta blockers are like those friends that help us chill out when we're stressed.
You got it. They help by keeping the heart from racing too fast or beating too hard, which can be really helpful for things like high blood pressure or even some types of arrhythmias.
That makes sense. So like a gentle hand on the heart's shoulder, telling it to just relax a little. Are there different kinds of beta blockers, or do they all basically work the same way?
Good question. There are actually a few different types, each with their own little quirks and specialties. Some are very picky, just focusing on the heart, and others have effects all over the body.
Oh, wow. So like having a bunch of specialized mentors, each one trained for a different need. Can you give me an example of when a beta blocker might be especially helpful?
Sure. Let's say someone's recovering from a heart attack. Beta blockers can be super valuable. They help lessen the workload on the heart, giving it time to mend. Like those awesome friends who bring you a good meal after a rough day.
I like that analogy. It really seems like beta blockers are the heart's best buddy, always there to help out and keep things running smoothly.
They're definitely important in cardiac care. And as we learn more about cardiac medications, you'll see how all these different types, each with their own way of working, come together to keep our hearts strong and healthy.
It's wild how we can think of these meds like they have personalities, like even friendships with our organs. Really helps to understand what's going on at a teeny tiny level. So we've covered stuff that affects how hard the heart squeezes, the heart rate, preload, afterload. What else have we got in our bag of tricks for a tip-top heart?
Well, sometimes the heart needs a little help with its rhythm, right? That's where those antiarrhythmic meds come in. They're like the conductors of an orchestra, making sure everyone's playing in sync.
That's a great way to put it, because in a regular heartbeat, that's like a symphony gone wrong, instruments all over the place, tempo's off, not a good listen.
Totally. And just like an orchestra's got different sections, your strings, your brass, percussion, we've got different classes of antiarrhythmic meds. Each one targets specific channels in the heart's electrical system.
Okay, so it's about restoring order, getting those electrical signals back on track. Can you give me an example? How does one of these meds actually work?
Sure. Let's take lidocaine, pretty common one. Think of it as like a local anesthetic, but for heart rhythm problems. It numbs those overexcited electrical signals in the heart, stops them from going crazy and causing an irregular beat.
So lidocaine's basically saying, all right, everyone, chill out, let's get back to normal. I bet these meds are crucial during something like a heart attack when that electrical system's really vulnerable, huh?
Exactly. Heart attack, the heart muscle is freaking out, right? That can mess up the electrical activity, lead to dangerous arrhythmias. Antiarrhythmics, they can be lifesavers in those moments, getting that rhythm stable so the heart can recover.
It's incredible. They're like tiny electricians going in and fixing faulty wiring. My notes also mention adenosine and digoxin. We already talked about digoxin, the wise old sage, but what's its role in all of this arrhythmia stuff?
Yeah, digoxin's a real multitasker in cardiology. We know it can make the heart squeeze harder, but it can also slow down those electrical signals in the heart.
Hold on, so it's like digoxin's this multi-talented musician. It can crank up the volume with the contractions and then be the conductor to fine-tune the tempo at the same time.
Exactly. Now, adenosine, on the other hand, it's more like a temporary circuit breaker for the heart.
Circuit breaker, that's a new one. Tell me more.
Imagine a power surge at your house, right? Things are going haywire, sparks are flying, it's a mess. Adenosine, it's like that circuit breaker. It cuts the power for a split second just to reset everything. It briefly slows down the electrical signals, especially through the AV node. That's kind of like the relay station between the top and bottom parts of the heart.
So it's like hitting the pause button, letting the heart catch its breath and get back into a normal rhythm.
You got it. Super effective for those crazy fast heart rhythms that can be really dangerous.
Wow, it's like having a whole team of experts. Strength trainers, calming mentors, electricians, even circuit breakers. All working to keep the heart going strong.
It's a beautiful thing. Every medication plays its part in this orchestra of the heart.
This deep dive has been amazing. From the basic equation to all these intricate details about how these medications work.
It's a lot to take in. Remember, this is just the beginning. There's always more to learn about cardiac meds as research discovers new things all the time. You've got a great foundation now.
I think the biggest takeaway for me is that it's not about memorizing names and stuff. It's about understanding how everything interacts, you know?
Absolutely. Never underestimate the power of a good analogy either. Sometimes those comparisons can really make all the difference.
100%. Well, that about wraps up our deep dive on cardiac drugs. We hope you learned a lot and had some fun with us along the way. Until next time, keep those brains buzzing.